Hello, my name is Lindsay and I'm a nurse here with Onsite Medical, and today I'm going to be reviewing with you assessment, interventions, education, and some general charting guidelines for injuries involving foreign bodies in the eye. It's unfortunate that even a small piece of debris can have a large impact on our patient's eyes. Corneal abrasions, rust rings, and even chemical burns can be common injuries that we see with our patients. Thorough and immediate assessment and interventions are imperative for overall patient outcomes, as some of these injuries can be time sensitive. To start off with, we need to start with our subjective information gathering. What is the patient telling you about their injury? Some different symptoms that they might be telling you is that there's burning, pain, headache, photosensitivity. They may even feel like the foreign body feels like it moves around when they blink. How is the patient feeling? Additionally, we must understand how the patient got the foreign body sensation or foreign body confirmed in their eye. What was the event leading up to their injury? What they were doing at that time, and how long ago did the injury occur? Remember that a chemical exposure to the eye that happened 5 minutes ago is going to be treated differently than a potential piece of metal in the eye that happened 4 hours ago. It's very important to understand what the patient's injury could be. Lastly, you want to find out the patient's previous medical history involving their eye. This includes any surgical history, even if they have any contact lenses in their eyes currently. If they do have contact lenses, we need to carefully and cleanly remove it if we're safely able to prior to our interventions. If any debris, chemical, or foreign body in general has attached itself to the under part of the patient's contact and it's still in their eye, the longer it's in their eye, the more irritating it is, and potentially the more damage it can do to the eye itself. After our subjective information gathering, we need to move on to our objective information gathering, and this is what we get during your physical assessment and examination. Different signs that you might notice during your examination for a foreign body injury are excessive tearing, erythema, edema to the eyelids, and potentially even discharge. We also want to make sure that we're testing the patient's visual acuity. It's imperative that we test it for the interventions, but beforehand, it's also a good idea to ask them, do they have any vision changes? Blurry vision, vision loss, any changes to their baseline are important to note so we know how they're coming into us. Here we have some various interventions that can be available to you if you work here at Onsite Medical. Now, one of the most important interventions that we can do when there's a foreign body in the eye is flush and remove the foreign body. That can be done a couple different ways. Some clinics will have access to large bottles of saline. Now, they're going to come in bottles like this. They're one-time use. You can pop the lid, and then we have this eye-safe, sterile, normal saline. We can use that. If you are using one of the bigger bottles, or even if you're out of these and you only had the small eye wash bottles, make sure that you're on one side of the foreign body if you can visualize it and you're just pushing it one way. We want to promote that foreign body getting out of the eye, which is best done by making sure the flush is going at the same angle. Next, we have eye cups. Eye cups are a fantastic resource to use if you have a foreign body sensation that's in the back of the eye. We've even used it in the clinic when a patient has come in for a personal medical reason because their contact has slipped to the back of their eyeball. Sometimes with those kind of foreign bodies, it takes a little bit of extra pressure to the eye to flush out that foreign body. How you use this is you pop the lid, grab one cup, and all of the cups have a little line in them. What you do is you get your eye-safe saline and you fill it up to the line that's already on the cup. After that, I always like to explain the process to the patient beforehand, but what they're going to do is you put your eye down, you place the cup over your eye and have the patient apply pressure, and then you flip the whole thing over so all of that saline has now been inverted and sitting in their eye. The cup is going to maintain pressure. I promise you it will not spill if they're holding enough pressure. And then what you're going to want to do is have the patient blink, 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 and look around for at least 30 seconds to a minute, or if they feel relief. When they're done with that, what you're going to have them do is flip back over and remove the eye cup. Don't empty the eye cup right away, because the beautiful thing about this is if the foreign body was removed, it's going to be caught in that, and you'll be able to make a slightly better determination as to what the foreign body could have been. Next eye wash that we have available, at least to us in this clinic, are actual full eye wash stations. Now, this is not going to be available to every clinic, so it's really important that you know what resources you have available to you before someone comes in to the clinic with a foreign body in their eye. There are many different ways this looks. Some of them have a foot pedal that you have to decompress. Some of them have a hand pedal that you have to push down. Ours, if you can see, actually the whole eye wash comes down from the wall. So just make sure that you're familiar with whatever flushing modality you have available to you. Next, for nurse providers only, we do have the use of prepared cane available, and this is going to be used if we need more invasive eye examination. So prepared cane is a fantastic eye-safe numbing agent that we can use. It's going to be in your refrigerator that we can use to numb the eye to make it more comfortable for the patient if we have to do under eyelid or more aggressive but gentle forms of getting the foreign body out of the eye. We start with 1 drop, and I always say we're just going to sit for a minute and let that numb up your eye. It is important to let the patient know, just for realistic expectations, that it's going to be cold and it's going to sting for just a few moments because it is a numbing agent. So for our nurse providers, this is an option for you. Once the prepared cane is set and the eye has been numbed, you can then move on to the eye exam itself, which can include flipping the eyelids and assessing to see if we can either see or swipe away a foreign body. Important note, remember, 1 swipe per swab. To assess the lower lid, have the patient look up towards their forehead, pull down on the lower lid, and swipe once. To assess the upper eyelid, you're going to grasp the patient's lashes, pull the eyelid away from the eye, and place the swab along the lash line, just above the lash line. With the cotton swab, you can then push the upper lid out and then swab with a clean cotton swab. Use as many swabs as needed. With your swabbing, you can also look and assess the eye under a fluorescein and black light assessment. Fluorescein, or BioGlow, is this fantastic tool that we have, and it's a chemical, it's an eye-safe dye that lights up under black light. And we'll show you what that looks like when we do have a foreign body show up under a fluorescein black light assessment. So the important thing to know if you are using the fluorescein or the BioGlow strips is that you have to get it wet before you apply it to the patient's eye. So what you're going to want to do is get some of your saline. And there are different ways that you can do this, but the way that I like to do it is I get my strip out of my pocket and I just carefully drop 1 drop of the saline onto the strap. Now, if this was the patient's eye, you can go and tap the eye and you notice the dye is able to be transferred. You don't need a lot, a little goes a long way. Next, after the patient has been dyed with the fluorescein, we will have these black lights that we'll be able to assess. This is what various foreign bodies and abrasions will look like in the eye under the BioGlow assessment. What's important in this assessment is to make sure that we're checking all directionality of the eye. So you can see that it lights up with the fluorescein under the black light. We're going to have the patient look down towards their toes while we lift up and assess the upper part. They can look up towards their forehead while we pull down and assess the lower lid. Now we want to make sure that we're checking all of the corners. You can direct them to look down and to the left, down and to the right, up and to the left, up and to the right. Make sure that you're allowing your patient to blink as needed in between. We here at this clinic had Refresh, but they're just over-the-counter lubricating drops. These are nice though, because I like to tell the patients these are just for dry eye. Typically, if they've gone in an eye wash, their eye is going to be a little bit dry just because of the constant flushing. The salinity in the eye wash, and especially in the safety eye wash, is a little bit different than the composition of their eyes, so it's going to feel way dry. So for us in these ones, this top actually pops off and you have about 8 drops in each vial. Because I usually like to put 1 or 2 drops in their eye and just let them lubricate again so they're not just uncomfortable, dry, and itchy. Because it just recaps and you have at least 4 more drops to use for later, as long as the applicator has not touched the eyeball. Moving on, we need to talk about when to consider referring the patient to a higher level of care. If the patient has an embedded, protruding, or perforating foreign body in their eye, they are going to require immediate attention from a higher level of care. If there is a visible foreign body that cannot be removed by the interventions that we already discussed, they need to be seen by a provider so they can do more invasive ways to remove that foreign body. If we remove what we believe is metal and there is a rust ring left behind, they must go see a provider so that can get removed in a higher level setting. If the patient states that they have increased pain after the foreign body is removed, that's a good indication, as well as if their discomfort lasts longer than 48 hours.
Additionally, ensure that you are looking out for any pus, drainage, redness or discoloration of the lids, or any visual disturbances as possible reasons to escalate care.
Some education that we want to give our patients at the end of their visit. The most important thing, the patient should not be rubbing their eye. If they have a corneal abrasion, or even if they have a more fragile state because we were able to remove a foreign body, if they rub their eye, there is absolutely the chance that they are going to worsen that abrasion or that discomfort. We need to dissuade that as much as possible, which again is why I love the refresh eye drops, because a lot of times it's just dry irritation that they're feeling after all of our interventions. So I like to load them up with at least 1 or 2 of these vials, educate them how to administer them safely, and tell them 1 or 2 drops every 30 minutes or so is usually plenty to make sure that they don't feel the need to rub their eye. So we want to start off with our subjective information. What were the patient's symptoms? Again, we are very specifically talking about what they are telling us. Was there irritation, burning, scratching? Did it feel like something just wasn't right in their eye? Use the patient's words in the chart and explain how they explained it to you, because this is the subjective portion of the charting. We need to talk about the symptoms that they might be experiencing more objectively as well, such as if we notice any excessive tearing, if there's any redness, if there's any swelling to the eyelids, or if we were actually able to visualize the foreign body or abrasion. If we note the abrasion with the black light assessment, a good method to use for continuity and ease going from provider to provider is using the clock method. If the foreign body is at the very top part of their eye, we call it the 12 o'clock, and you just pretend like a clock is sitting in front of their eye. That way you can indicate, oh, there was a abrasion noted at the 3 o'clock portion of their eye. That way it's very descriptive and it's easy for the next provider that's coming after you to know exactly where to look and to see if that area has improved. We also need to talk about the treatment that was provided to the patient. And again, we need to specifically talk about what we did to the patient. You can't just say rinse patient's eye, because as we talked about, there are definitely different modalities on how to get that done. Did you use a big bottle of saline? How much did you use? Did you use the eye wash station? How long was the patient in there for? Did you use an eye cup? How many did you use? These are all important specifications to remember when you're charting about what you did with the patient. We also need to talk about how and if the foreign body was removed. Did we remove it with a sterile moistened cotton swab? Did the foreign body resolve with the flushing? We need to talk about that as well. We also need to document under the medication section if we used any of our medications available to us. Make sure that that is documented under the medication area of patient assessment form. One of the most important parts in our charting is documenting how the patient responded to the treatment. Foreign eye assessments and treatments can be uncomfortable and unnerving to the patient. We need to talk and discuss about how the patient responded to the treatment and the interventions that we did with them. If it was uncomfortable, what was painful, or if at the very end they felt relieved and their symptoms were resolved. One thing to note is remember the repair can last longer than a few minutes, so if they say they feel nothing, it might be for that, and it's important to reassess later on in the day. Lastly, we need to talk about if the patient was referred out to a higher level of care and why that was. An example would be noted foreign body to the 3 o'clock portion of the eye, attempted to remove with a moistened steel cotton swab and unable to remove it. Thank you so much for being with me today while we go over and review foreign body injuries in the eye. If there are ever any steps, interventions that you have questions about, be sure to reach out to your leadership so they can help you through it. Remember that all of this information is available to you on Trainual, and I hope that you have a very good day.